Hey, you guys. So, I want to talk about how to optimize your body for pregnancy because one of the things I'm noticing is that the appears that the rate of infertility is going up significantly. And part of that might be because women are waiting later to get pregnant, but there are a lot of other factors that can contribute to infertility. And so I want to talk a little bit about things that you can be doing if you are interested in having a baby. So the first thing I want to make a point of is that the longer you wait to have a baby, the more likely you're going to have difficulties. Now, this doesn't mean that you can't have a baby later in life, but one of the reasons I'm seeing so many women go into infertility treatment is because they're waiting longer, not recognizing that it can be harder to have children as you get older. So this is not to discourage anyone. I just think it's important that women know early on in life that the longer they wait, the harder it may be to have children. Now, that's not the case all the time, but it's important to know. The other thing is that nutrition matters. So one of the things that really gets under my skin is when people tell you, particularly when you're pregnant, that you can eat whatever you want. And when you're trying to get pregnant, and actually when you're pregnant is probably the most important time of your life to really care about what you're eating. You want to make sure that you're eating high nutrient dense foods. So making sure that you're avoiding processed foods, that you're eating lots of vegetables, and that you're getting all the nutrients your body needs to create an entire human. So if you have not put some intentionality around ensuring that you are eating a nutrient dense diet, not just a calorie diet. I don't want you to focus on calories as much as I want you to focus on food quality. If you're not sure what that means, then that might be a reason for you to either get a health coach, see a functionally or holistic doctor or a nutritionist, but you really want to develop a diet that supports the body to conceive and to grow humans. And then the other thing I see is a lack of knowledge around toxin exposure. So there are a lot of toxins in our environment that can actually influence fertility. And these toxins can be found in skincare products, can be found in the air we breathe, the water we drink, and chemicals that we put on our dry cleaning and on our couches and the plug-in air fresheners, all these toxins around us that you may not even know that you're being exposed to, that over time accumulate in the body and can cause problems with fertility. And so one of the things I encourage people to do is to, number one, be aware of the toxins that you're being exposed to, limit your toxic exposure, and then optimize your body's ability to detoxify. So really thinking about toxins and detoxification is really important. And then the last, but probably the most important, is stress. And not the fact that, avoiding stress. It's about how we manage stress. And this is something that is going to impact every aspect of our health, but really impacts our fertility. And if you're not thinking about how you manage stress, right, then this can lead to an imbalance in our nervous system that causes hormonal problems that leads to infertility. So what do I mean by that? So there are techniques that we can actually do to shift our nervous system from fight or flight, which we also call sympathetic, into a rest and digest, reproduce. And so we want to spend more of our time in rest, digest, reproduce, which is also called our parasympathetic nervous system. We want to spend more time there than we do in the fight or flight or sympathetic. And to do that, particularly in this day and age, we have to be intentional about shifting from fight or flight into rest, digest, reproduce. And that can look like deep breathing exercises. It can look like exercise. It can look like the foods we eat. It can look like the microbiome or the bacteria in our gut. It can look like the strategies we have to deal with stress. It can look like avoiding stressors. So there's a lot we can actually do. And if you're not focusing on that, then you're missing a huge piece of the puzzle. So there's a lot of other things that can influence your fertility, but I think this is a great place to start. And if you are interested in working with a doctor who really focuses on optimizing your health for the purpose of fertility, then, think about seeing a holistic, integrative, or functional medicine doctor like myself.